Really warm welcome, everyone. My name's Sonia Kumar. I'm a GP and I'm the Director of Undergraduate Primary Care Education at Imperial College London and MEDIC, the Medical Education Innovation and Research Centre, Nour.
And my name is Nour Houbby and I'm a fifth-year medical student studying at Imperial College London.
So we're delighted that so many of us could join us today at Imperial College London's Medical Students at the Frontline event. We're really excited to have all of our amazing medical students with us today and really to think about and reflect on the COVID-19 pandemic, which unfortunately is still with us, still very much with us 1 year on, and how many countries around the world, including our own, are still very much struggling to control this virus. Our thoughts are with all the healthcare professionals and everyone in those countries at the moment, particularly struggling, and with the damage that the virus is causing. Today's live event was inspired by our medical students who participated in a global competition last year that some of you may have been part of or knew about. We were really taken aback, quite amazed last year at just how amazing the medical students were, their levels of creativity, their insights, their honesty and thoughtfulness of how COVID-19 had impacted on their personal and professional lives. And so we wanted to hear more, a year later, of how medical students around the world are navigating these ongoing challenges of COVID in their countries and what this next generation of future doctors have learnt through these difficult times. And importantly, probably most importantly, what they can teach us as we try to move forwards. We will be recording today's event, so if you know anyone who was unable to attend, possibly because of time zones, do let them know that we will be posting a recorded version on our website, and also we will be tweeting it on the Imperial Medic account. Over to you, Nour.
Thank you, Sonia. So today's event will be a live panel discussion event and we'll be asking our wonderful medical student panelists questions. We also want to invite you, our audience, to submit your questions via the Q&A function because we want to make this an interactive event, and we'll also be taking questions from our audience. So we also welcome you to submit words of support or encouragement for our panelists, also using the Q&A function, or you can also follow us on Twitter and use the hashtag Global Medical Student on there as well. Now, without further ado, it's my great privilege and honor to introduce our panelists. So today we're joined by Akelekeh.
Hello, everybody. I'm Akelekeh, a fifth-year medical student studying at the Faculty of Medicine and Biomedical Sciences, University of Yaoundé, Cameroon.
Thank you, Akelekeh. And we're also joined by Reuben.
Hey everyone, I'm Reuben. I'm a third-year medical student at the University of Melbourne in Australia.
Thank you, Reuben. And we're also joined by Lloyd.
Hello, everyone. I'm Lloyd Anicier Barba from the Philippines. I am a third-year medical student of Far Eastern University.
And welcome also to Gökdeniz.
Hello, everyone. I'm Gökdeniz. I'm also a third-year medical student in the University of Bologna, Italy.
Amazing. And finally, last but not least, also want to welcome Museera.
Hello, everyone. My name is Museera, and I'm a fifth-year medical student studying at Alfaisal University, Riyadh, Saudi Arabia.
Amazing. Thank you very much for joining us today. And we're really looking forward to our really exciting panel discussion. So the first question that we want to present to our panel is, what has it been like for you being a medical student in the last year in the pandemic? What has that experience been like for you?
I think I'll go first if nobody minds that. Definitely the biggest impact has been, or at least personally for me, has been on our studies. Since I'm a fifth-year medical student currently rotating in hospitals through clerkship. Because of COVID-19 regulations, we were not able to get as much exposure as we would have liked to patients, to see patients, to practice, and in ORs. And I think that did negatively impact us because, as we all know, medicine is beyond what we learn in books, and we have to practice it to be able to master it, really. So that was my personal experience during this pandemic.
So did anyone else find that as a challenge of kind of not being able to see patients as much as maybe our previous years have been able to see it, or had a similar experience?
Hello. So I really relate with Museera because the pandemic really prevented us from the opportunity of meeting actual patients to examine. So I feel like there is also right now, I feel like there's a lack of practice on our part of establishing rapport with actual patients, which is very essential in our job as clinicians, our future doctors. So right now, I really feel that I am stuck. Um, Partly because, wait, I'm gonna tell a little bit of a story. So if it's okay, but I'd like to hark back on the first day of med school, and there's this really constant cautionary message from our professors that this is med school. You'll be dealing with actual patients. They will be entrusting their lives to you. So it's better to fail now in your medical education than fail later in doing clinical rotations, etc. And then the pandemic came. So aside from that inherent pressure to do good as a medical student, because we are actually dealing with actual lives of our patients, the pandemic is actually severely challenging in the Philippines as well as in our educational landscape right now. So it's a huge hurdle because both for medical students and for our professors as well, because coming from the Philippines, which is a developing country, and where online learning is actually almost like a new concept for us because we have been accustomed to like purely face-to-face learning due to the unreliability of internet connection. So many of us also are technologically challenged. So it's a huge learning curve for all of us, I think, especially for Filipino medical students out there.
Yeah, I think I agree with the two previous speakers, particularly Lloyd, because coming from Cameroon too, which is also a developing country, online learning is something which is quite new. We are at 1 year of trying it and we're still getting used to it. So with the pandemic, particularly during the lockdowns, it was not easy getting a stable system set up to be able to study online. Adding that to the fact that we were no longer in contact with patients, it became very difficult to be able to practice what you've learned. We were stuck at home. All you had to do was read. That gives you the impression that you have a lot of time. And as students, when you have the impression that you have a lot of time, you tend to do nothing. So there was that problem too. And after the lockdown was uplifted, classes resumed gradually, clerkships resumed gradually too. But given that we had already lost a lot, there was this rush to meet up with syllabus and everything, which turned out to be ineffective as compared to before the lockdown. So students had to do more and more to catch up. So there's that, and then after the lockdown, patient turnout at hospitals was quite low because people here have the impression that when you go to the hospitals, that's rather where you go and get infected with the COVID-19. So patient turnout was quite low and you no longer have that exposure.
So Akelekeh, you mentioned that you experienced studying in lockdown and then you came out of lockdown. Aside from like studying, what was your experience of lockdown? It's something that we've never really lived through. What was that like for you as an experience?
Apart from studying, lockdown also gave me time. As I said, we had a lot of time. So I had time to be able to do other things out of the medical field. I was opportune to attend many Zoom meetings online, many webinars, and also to search for opportunities online, one of which was the medic competition, which led to my presence here today. That was all thanks to COVID. And I also had an opportunity of taking online courses in things that are out of the medical field. So generally, COVID was not all that bad for me.
Mm-hmm. So we talked about some of the challenges that many of us face about online learning. Some Akelekeh talked about lockdown. What about any kind of opportunities that, do you think that this period in the last year, what we've lived through, do you think that there's any opportunities that have risen from it, or maybe it's given you a new perspective on something? Could I bring in maybe Reuben, if you want to contribute some of your insights?
Yeah, look, I think this whole thing has been very humbling, and gives you, particularly, I guess, in Australia, kind of having a bit of a taste of what like a post-COVID environment might look like, where you have the risk of community transmission, but it's not really happening, but may happen at any time. I think you get an appreciation for how skilled, well-trained, and how knowledgeable doctors have to be to just treat a patient safely and responsibly. I think as medical students, we are some way away from practicing, actual medicine, and it's perhaps indicative of, our standing in the hospital that we weren't allowed back in during, well, I assume most of us weren't allowed back in during the lockdown. Medicine is very much a vocation. It's very much a skill, a practical skill, and it's intertwined with, but distinct from academia. And I think, I have a great respect for the skill, the art that is to practice medicine, different from however much you can learn from a book that we got the chance to do last year. Yeah.
So I know that many of us read about the experience of kind of living in Australia in this current times, and something can be quite a contrasting experience to what maybe other countries are experiencing. Could you talk to us a bit more about what it's been like in your country?
So I guess it's kind of states specific. Australia did have kind of nationwide lockdown around March or April last year. And then most states all states somewhat came out of that by mid-year. However, my state of Victoria kind of went through a second wave, and then during which we locked down for several more months after that. And from about July until October or November, we were all at home under fairly strict restrictions. So then, yeah, Victoria is a bit of a different case. So we're probably the only state that's gone through a protracted sort of lockdown. I think these days, actually what's happening right now in my city of Melbourne is that there's been another uptick after a good couple months of no transmission. There's been a few cases today, and everyone's just kind of on edge. And I think everybody's just waiting for, when might the next wave happen, and how we're going to prevent that. So I think everybody's a little bit on edge. And interestingly, we see today in the news that the vaccine take-up suddenly went up today. The tests suddenly went up today. So I think, yeah, there is an interesting aspect to kind of being, kind of looking back from this position. Yeah.
I can kind of understand your situation in Australia. I think here in Saudi Arabia, after our first lockdown, we didn't have another wave. And right now, like you mentioned, we're afraid to have another wave. And I think because of vaccine rollout, people somehow they started getting more lax, and that made the government very worried about getting another wave, because lockdown, like in lockdown, we had two situations. Either people had the privilege to be able to stay in their homes without having any job insecurity or being worried about food and such. And on the other hand, there are people who really suffered, businesses that really suffered during lockdown. So I think there is this sentiment in Saudi Arabia as well that we don't want another lockdown, and they're trying to make sure that it doesn't happen again, especially with so I'm graduating soon, inshallah, and we have restrictions on our graduations as well. We're not sure what's going to happen. And I do understand that COVID has gone on for so long that we're all kind of tired of it and we want it to end. But still, we have to be very careful, especially during this time, because we might have another spike. And like we saw with the initial wave, everything happened so suddenly. And I think that is a worry for us as well.
I could say that the situation is also similar in Italy, because in the first semester, starting from, for example, the beginning of January until, let's say, the end of mid-April, I can speak for my region in Emilia-Romagna. We were under lockdown, complete lockdown. We were in red zone, meaning that no one could get out. We had curfew. All the businesses were closed, clerkships were canceled, etc. And the numbers were not very optimistic. So people were right to be scared, and we didn't have much information about the vaccine rollout. Some people received AstraZeneca, and then it was pulled away. Then we did not know what we were going to do, and the Pfizer vaccine, we didn't have any information about it either. So people are very scared. But now, with over time, the situation got better because of the certain restrictions that were enforced. And now we're back in the yellow zone, for example, which is much more relaxed, and the clerkships are back again, etc. But because of that, I also understand, because in my city, Bologna, for example, is a kind of a university city, meaning that there are a lot of young people. Obviously, they're kind of tired of the whole quarantine situation. So every day there are certain, for example, in the city centers, people are gathering, trying to have fun, etc., trying to, have a social life again. And almost every day, or like every weekend, you can see police clashing with young people, trying to disperse them. But obviously, they're not very successful every time. So I also understand the sentiment of people trying to, normalize their lives in a way. But obviously, we still have to be careful about it, so that we don't have a second wave coming where we don't have to go through the same red zone quarantine again. So
yeah, that is definitely there are definitely challenges of trying to adjust to this new life that we've really faced over the last year. I wanted to also, before we bring in some of the questions from our audience, just move on to thinking about how the last year has impacted you on a more personal level, so on your wider life, on family and friends, and if anyone has any thoughts that they want to bring in on that.
Okay, so I just want to share a few of my thoughts. I think after this whole year of COVID, one of the things that I'm trying to really embody in myself is that, life is uncertain. Somewhere along the way, we thought that we will make our own plans and our plans will go accordingly and everything is going to go smoothly. But I think COVID really brought up this new insight that, we should always be ready to expect the unexpected, and that we have to be able to adapt to this, and to be able to understand that not everything is going to go the way that we want to, and that's okay. It's not a bad thing. Life is uncertain, and I think that was one of the lessons that I truly learned during this pandemic.
I think I really resonate with that, and I think one of the other things that this last year really kind of brought to life for me is kind of the appreciation of the little things, and just appreciating that the life that we had, seeing family, seeing friends, all of those things I really kind of took for granted, and was very, and I think this year really humbled me in that way, and I realized, I really valued family, really valued friends, I think more than I have ever really done. It just completely, it's a really different experience to go through, and I think, that's definitely a big reflection. I also wanted to ask Sonia now if there's been any questions from the Q&A from our audience that we can ask the panelists.
So there is a question, but I cheekily am going to ask one ahead of the one that's on there. I think, Museera, what you said about uncertainty, I mean, that's quite a big theme of just learning to live with uncertainty. And that's, I suppose, personal uncertainty, but also, Reuben, as you mentioned, there's sort of medical uncertainty. You think you're over a curve. And then as we're all realizing, the variants are questioning whether we'll ever be over this sort of the pandemic. What do you think we can do to support you in learning to live with uncertainty, particularly as a doctor? Because that's such a big theme as a doctor. We like things to be concrete. We like to know that things are right and wrong, true and false. That's how you're often tested in your exams. How do you think we can support you? What advice can you give us?
That's actually a very excellent question. And I think I'll really thinking about this. At least off the bat, I can say that the thing that really would help the most would be to have empathy from other doctors, from administrations, from university bodies, to understand that we're all going through the same thing at once, and to be able to share our concerns and uncertainties with them and realize that we are being heard. I think that at least right now, that would feel really wonderful, because I think in this pandemic, at least personally, I felt like in some factors, I felt I was doing this all by myself. And had it not been for the support of my friends, I felt like it would have been devastating for me personally, because it was such a new thing. And I think this pandemic should bring us together as a community rather than, rather that we go our way separately.
I totally agree with Museera, because as she said, we actually need a lot of empathy from others. We actually need a lot of empathy from those who are not in the medical field, those who are around us, because we are actually going through this all together. But as those on the front line, the load, the burden is not quite the same. Like, you could leave the hospital, when you get back home, those maybe around in the neighborhood, your friends who are back there, they actually need to understand that you're coming from, I don't know if I should call it a battleground. You're coming from struggling with this pandemic ahead of them. And that support, I think we need that moral support, that empathy from those around, from those above too.
That actually leads us really nicely onto one of the questions from the audience, which is a difficult question, but how are you all coping with this stress?
Well, I'm personally
trying to learn how.
Yeah, trying
Sorry
to.
about that.
No, it's okay. Okay, I was gonna say, I'm trying to focus on personally what I can and cannot do. I'm trying to prioritize the things that I need to do. For example, if I have a clerkship I need to do, I'm trying to focus on doing my best at that. And I'm trying to spend time with my family, my friends, etc., so that I can recharge and relax a little bit. Overall, it has been a difficult process for everyone in the last 2 years, but I agree very much with what Museera said about the fact that life is very uncertain. And there's the most important thing, I think, as future doctors, for us to understand, is that we need to be adaptable, and not only to extreme situations like this pandemic that we're experiencing, for example, but in general, medicine is very complicated, and not everything that we're going to say that we're going to be prepared before. We're going to see new things. For example, I'm doing a cardiology clerkship right now. I've been doing it for, let's say, a week. And that, for example, I've learned in this week, the things I've learned in this week has been much more than what I've learned in an entire semester, for example, just reading from the books. And I think like you said, the empathy and the support of mentors is also very important. And also, I think they are also going to be the ones that push us to at least to try to be ready for any future crises or any new situations that we're going to face in the future. There's this one thing that our attending doctor said to us yesterday that really resonated with me, so maybe I would like to share it with you. He said, there are a lot of graduates of medicine, but not all of them are doctors. And he said, in my career of 20, 30 years, I've seen only a couple of doctors. And most of them are just graduates of medicine. So if you actually want to become a doctor, you have to, get used to seeing patients, communicating with them, and learning how to be an actual doctor rather than just trying to pass exams and put your head inside of a book, etc. So I think overall, it's a very important thing to pay attention to what's important and what's in front of you, and to be able to adapt to new situations and life in general.
I'd like to add something to that as well. I really resonate with what Museera said about, extending empathy to one another. And I think one of the ways in which we can deal with stress is having empathy to yourself. And I think we often forget about that. I think medical students, medicine attracts a certain type of personality, a type A, maybe even a bit neurotic, hyper-competitive sort of personality. And and that kind of carries its way up. And I think it'd be good to try and deconstruct that a little bit over time. And you can see how, and that kind of extends into society, how if you get it right, you're God. And if you get it wrong, you're going to get sued, or you may get sued. And I think, yes, medicine is a very consuming identity. And I think we put a lot of pride in that and a lot of our meaning in that. But I think it's good to remember that we are human and we can get it wrong. And, first and foremost, we're people before we're doctors, and people make mistakes and people get stressed out. People have flaws. And I think we ought to all remember that. Yeah.
Wow, I mean, yes, you've got us eating out of your hands, guys. So
totally just mesmerized listening to those.
I know. So there is a question actually which links a little bit about, I think, seeing patients and having possibly a useful role. And again, it's what advice can you give us of how medical students can be useful in times of crisis, but perhaps more generally in medical training, undergraduate medical training?
I think with regards to that, you already said, you actually need to be aware of what you can do and what you cannot do. As medical students, as undergraduates, we need to, as Reuben earlier said, you need to take care of yourselves first, because this is a pandemic and we are all going through it the same. We are exposed as medical students, so initially you need to take care of yourselves first, and then you be aware of what you can do and what you cannot do at the level of the hospital. And your interactions with patients, you need to always think of yourself too. You don't work selflessly and then you end up being in the patient's place. So I think you need to be aware of what you can do and what you cannot do. You need to know your limits. You do what you're normally supposed to do as a medical student, but then given the context we are in now, you need to be more careful than before.
That's very good advice, and I totally agree with my panelists over here. I would just like to add, based on my personal experience this 5th year, so 4th year for us is clerkship, 4th and 5th year are clerkship years for us. And I keep comparing my pre-pandemic clerkship to my post-pandemic clerkship. And what I realized was that I feel like because of this pandemic, I started to become more, have more empathy for patients. My goal usually would be to come to the hospital, see patients, see diseases, basically, see their symptoms, practice physical examination. How do we manage these patients? And I was not really looking at the patients. And I think one of the, so basically I have another story. One of the moments that really resonated for me during post-pandemic clerkship was during my ophthalmology clerkship. I remember I was focusing a lot on the diseases of the patient, and I remember that my consultant told me that just be nice to patients, just try, just show that you're interested, or just try to talk to them. It doesn't necessarily have to be like medicine related, because I would feel this uncertainty that I don't know how to help these patients medically. And after listening to his advice, I remember I only greeted a patient and I just asked her how she was doing and how she was feeling that day. And I ended up getting her number. And she invited me over to her house because of how she felt after that interaction. And I really did truly feel that during that time that I was focusing so much on learning that I wasn't focusing as much on the environment of patients, because some patients, like for everyone, we have different struggles, we have different things we focus on. So what's important to the patient may not necessarily what we think is important in regards to treating a patient. And I think this is one of the things I would sincerely advise to all medical students, to try to look beyond medicine. Try not to just look at diseases in patients and to see them as a whole.
Yes. Hello. I just want to add something. So as to the question, what can I do as a medical student in response to this health crisis? Also, that question is really striking to me because I had the same question few months ago. So as I've mentioned earlier, I have been stuck. I feel like I'm stuck in listening to lectures. I'm sitting behind the desk, attending classes. But when I thought about that, what can I do more? And given the current situation that we are in, we are not allowed to actually go to the hospital because of the rising number of cases. So I asked myself, what can I do more? Every day, I always ask that, and that's when the day came when I grabbed an opportunity to be part of an organization in the Philippines. It's called AMSA Philippines. Um, so it's actually a network of medical students all around the country, and it provides platform for advocacy for medical students, pushing for better healthcare, social justice in our country. So right now there's a lot that I can share about how my work in this organization has been, but right now we are conducting a COVID-19 anti-fake news, anti-misinformation campaign because medical misinformation is really rampant in the country right now. And what I thought as a medical student, if I cannot go to the hospital and see patients, maybe I can spread information, factual information to fight fake news, to fight medical misinformation that are dangerous to the public. So what I did actually concretely is I gathered um, a group of medical students in the country. I think we're 23 right now working in this campaign. So we post publication materials, telling people that what's factual and what's not, why you should take the vaccine, and why just to provide a contextual approach to to all Filipino citizens right now about COVID-19 status in the Philippines. So with that, I think there are just to all the medical students listening right now, there are just many things that we can really actually do as even if we are just medical students.
I'm impressed, Lloyd. I'm going to do this in my region now. That's actually an excellent idea. I think, yeah, like you mentioned, just being medical students doesn't mean that we're limited in what we can do. And definitely we should be at the forefront of combating misinformation regarding COVID and regarding vaccines. Thank you so much for the idea. I absolutely love it.
And it's something we've been trialing as well this year, medical students being involved in sort of community action projects around COVID and the vaccine and vaccine hesitancy. Are there any other examples that people have on the panel of other types of stuff that you've been involved in where you sort of feel that you're contributing, or has the medical learning been taking sort of more priority over contributing service?
Still in line with misinformation, on my own level, I've been participating in a few debates on WhatsApp groups from my past schools, from my alma mater. There are times that we just bring up topics that we know are going to instigate debates, various ideas like vaccine hesitancy, for example, like what people think about the COVID-19. Is it real? Is it this? Is it that? So from time to time, we usually bring up topics like that. So we get to know what our friends, community thinks about it. And then based on the information we get back, we can now give them the right information. We can now give them evidence-based information and try to advise on what is true and what is not, and how to go about it.
We also have a similar project here in Bologna involving a social center. A lot of medical students are active in it through a student organization called Prometeo in Italian, it's basically Prometheus. It's basically, there's a group of people with bikes that go around in the city to find homeless people and to talk to them, basically to see if they have any needs, such as clothes, something warm to drink, any medications. for example, information regarding to their needs, if they need a place to stay, etc. They're gathered every day, and then this information is basically relayed to other centers in the city to see if you can, for example, find a place for these people to stay, or if there are any medications that we can gather from people who are volunteering, etc., or any extra medication that we can get from the university hospital, etc., so that we can reply to the needs of these people. I think this is, I mean, I've been part of this. I'm not extremely active in it, I could say, to be honest, but I try to follow it and try to, help as much as I can. And I find this project to be very helpful. And I think it's also a part of like a volunteering-based health clinic that is also a part of the social center. I know, for example, every Wednesday, they do free COVID tests to everyone. They offer psychological help free psychological help to anyone that goes there. So in general, I think it's a very good initiative. And I know that a lot of medical students in the hospital can also take part in it as interns or they are doctors. They can work as volunteering doctors, etc. So not really related to the information.
You've raised so many important points, and it's actually really inspiring to see so many of the initiatives just from all of our panelists. I want to now hand over to Sonia because she's going to take us through the next main question, and then we'll also be taking questions from the audience. So over to you, Sonia.
So I am aware that there are many, many questions, and so just an apology in advance, we may not be able to get to all of them. A lot of questions do seem to be linked to my next question, so hopefully I'll be able to integrate some of what I'm seeing in the Q&A. So the next question, I guess, is forward-looking. So this is a question to our medical students. What do you think you've learned through living through this very unusual time, this global pandemic? And how is it going to impact on you, your future career as a doctor, maybe your career aspirations, maybe how you think healthcare should be designed and delivered? So a lot in that question. Feel free to pick up any bits of it. But it's, I suppose, what you're taking from this and looking forwards.
So
If
for
I,
me,
no, go on.
Museera, why don't you go first and then Akelekeh?
Okay, so for me personally, I've always dipped my toes into public health. And during this time, it really re-sparked that passion inside me that regardless of what specialty I may choose to go into in the future, we all should have a very active role in public health. I've noticed in so many of in the clinics that I've attended, regardless of the specialty, that there's always some sort of public health question that the patient brings to the doctors. And I think it's very important for us to be aware of these public health issues and to know that evidence-based recommendations based on research, and be ready to just give it to the patients instead of thinking that this is only the responsibility of family medicine or primary care. I think that for me personally has been one goal that I really hope that I can continue onwards.
Yeah, and what I wanted to say was on a personal level. First, on a personal level, I have come to realize that good health is something that has been underrated. A lot of people take it for granted. Because when you look at the symptoms of COVID-19, something that starts as symptoms of common cold, you could just have a cough, and it's something that we take for granted a lot. And you look at how fast it goes from cough to respiratory distress and to death in a few days. You get to realize that we have to pay more attention to our health. We don't need to take the fact that we are walking around, we're not lying on hospital beds. You don't need to take that for granted. I think I have come to learn that we need to pay conscious attention to our health. We need to pay conscious attention to staying healthy. And going out to medical students, I don't know if it's the same thing out there, but back here, it's almost impossible to see a medical student go to the hospital to consult. medical students, I don't know if they feel that they can't be patients or what. They always have an impression that they can handle their little health issues on their own. But I think with the COVID, we have come to learn that we need to consciously take care of ourselves. You need to be aware of what's happening as regards to your health and take conscious steps to stay healthy.
Thank you so much, Akelekeh. Actually, you reminded me of a personal situation that happened to me. So, alhamdulillah, I've never had any health issues. I'm really grateful for that, thanks to God. But I do have some members in my family who have like asthma or any sort of situations. And one of the things that I've really appreciated is to go with them and to experience what it's like to be a patient, especially in hospitals you work in or hospitals you're familiar with. It really gives you a completely different perspective to see what it's like to be a patient and how they're able to face situations. I remember recently I went with my mother for her clinic, and I never realized how there was the distance between, this is just a small thing, of course, but it was just, I never really realized the distance between the radiology department and the clinic where she had to go. And I thought to myself, oh, this is something that patients deal with every day. And if I was part of the hospital administration, and if I knew about this, there should be some sort of support to patients to be able to navigate from different departments to other departments, and to be able to, you know, successfully navigate their schedules and what visits they have. This is like such a small thing, I know, but I truly felt it from the patient's perspective, where I was lost and my mother was lost.
It's a small thing, but it's a huge thing, isn't it?
Yes, yes, definitely, especially when you're lost. It's a nightmare.
So I suppose you've already mentioned, Museera, you talked about, you know, an interest possibly in public health, and that's not public health necessarily as a specialty, but just an interest in public health irrespective of what specialty you go into, and absolutely agree with that. I'm just interested to hear from the others. Has this changed maybe the type of career you might go into, because there was a lot of questions on career aspiration, or maybe possibly even just more broadly the type of doctor that you want to be. And I really like Gökdeniz, your supervisor's comments. Absolutely, there's a graduate of medicine and then there's being a doctor, and they're very different things. Gökdeniz, and then I was going to draw on Reuben, so why don't you go first?
Okay. So what I realized in that period is that I didn't change in general my idea about pursuing maybe a different specialty. I'm still more or less on the same path, but I could say that what I was thinking about, like the big problems that we have in the world in general before this pandemic, they didn't change, but I think we've just seen like a basic confirmation about how, like, for example, the extreme greed and the unequal distribution of certain resources and our inability to cooperate with each other in times of crises. We've seen how it affects us and how, like, it has terrible consequences for everyone. And I would also like to, because I remember that recently, we came to terms with recently, for example, like the spreading of a new disease because of colonialism in the global south and disruption of ecosystems and destruction of vulnerable communities is not a new concept. This is not the first time that this is happening. There are other examples of this previously in the history. And what I realize is that if you don't do anything to change maybe the whole system and how we arrange the relationships among different countries, if you don't arrange the accumulation of wealth, resources, the healthcare systems, etc., in a way that will benefit everyone, benefit the majority, that we're going to have similar problems again and again. And even if we learn to better mobilize the healthcare responses that we have, it's only, for example, I think it's just treating a symptom rather than the cause of the problem itself. And I think it's also connected to the other problems such as climate crises, poverty, immigration, etc. So I think we need to look at these problems from a greater perspective rather than just focusing on small incidences in small countries and trying to react to it as much as we can. It's also nice, but I think we should also take a step back and to see what what is causing all of these issues that we have today.
So the bigger picture. Lloyd and Reuben, what do you think?
Yeah, I'm happy to talk on that a little bit. Yeah, I think the way it's changed how I think I might practice in the future is, I believe that COVID has exposed a lot of things that were sitting just right under our noses. Talk about things like people in lockdown, and then the increased rate of domestic violence, the increased rate of divorce, mental health crisis associated with that. And I guess one thing that was quite shocking to me at the beginning, and I guess kind of continues to be, is like how just obvious I think the level of racial discrimination has become. And I think that it's something that we can all be susceptible to. When something like COVID kind of is very easily politicized, can divide us, it stokes a lot of fear, it stokes us into panic buying, it stokes us into our more base instincts. I think it's important that we can just be a bit more empathetic with each other, see how we're all vulnerable to these sort of things, and also just that I think a lot of suffering that we have in this world, a lot of disease is invisible, and as the clinician, we don't always see that, or when you have a disgruntled patient, we don't always see that. And I think to just keep an open mind to something like that, about how we can be both perpetrators and victims in these sort of things, and to just try to be aware of that and do what we can in the future, and just be the more sensitive, empathetic, or be as sensitive and empathetic a clinician that I can be.
And Lloyd, did you want to add anything?
Yeah, if I have to add something to those wonderful speeches, for my case, I actually entered medicine for one reason only, and it's to serve my people. Like, because as I saw back there when I applied for a medical school, there has been an alarming lack of health workforce in the country. But actually, we produce just enough medical workers in the Philippines, but many of them do not actually stay in the country. They work somewhere else. But right now, with this pandemic in the picture, there has been a kind of a reorientation of my purpose, because aside from the lack of health workforce, I also saw the need for health leadership. Leadership has been lacking for medical students as of this point, particularly in my country, because many of us just want to graduate from med school just to become a doctor, to specialize in something. And they do not realize that they are part of a system, of a bigger system. And right now, I'm kind of deviating towards that field. I originally wanted to become a surgeon, actually, but now I am deviating towards diving into health systems management right now, because I saw that with this kind of situation that we are in, we doctors should steer the wheel, in these times of crisis, because it's a health concern primarily. So that's one of the realizations or learnings that I have realized during this time.
Thank you. So we've got about 12 minutes left, and we've probably got, I can see lots of questions. So Nour, are there any questions that you'd like to pull out to ask the panel?
Yeah, so there's lots of questions, but I think what I also want to mention is that there's also a lot of support and encouragement in the Q&A, just saying that they really agree with the points that you've been making, and that they find you all really inspiring. So I just wanted to put that in as well. So one question that came through was around, say, medical education, and we talked about that more right at the beginning. But what do you think, or what would you like to see change in the future of medical education, and how has this year changed that for you? Shall I bring someone in to answer? Akelekeh, can I pick on you? How do you see the future of medical education?
Thank you for picking on me. The future of medical education as it stands now, let me talk in context with my country first. As it stands now, I think we need to start looking at the formalizing digital learning too, because as Reuben earlier said, the COVID-19 has come and exposed a lot of things that were under our noses, but we were not paying attention to. So for medical education, I think we need to make it normal to have digital learning too. We don't need to just be stuck to a classroom and a teacher. We need to look out of that, and we need to be able to apply, better apply principles of public health, as he said too, because it's not all about graduating and specializing in maybe surgery, cardiology, and all that. We need to pay attention to public health, because this pandemic, for example, is something that could be prevented with everyday measures, but we needed people to point that out. We needed people to go out and be able to sensitize. And I think that is mainly centered around public health, being in communication with the communities. So I think as regards medical education, there should be more emphasis on digital learning, and there should be more emphasis on the importance of public health. Thank you.
Thank you for that. Thank you for that. There are also quite a few questions about mental health, and that's been a really big highlight in this last year. The importance of mental health, the challenges that many people have faced, especially those working on the front lines. So some of the questions that have been coming in have just asked about how have you what activities have you taken up, or what things have you done to relieve stress? What has been your experience with mental health in the last year? A really big question, and we've only got a few minutes, but I would love to hear your thoughts.
And again, I suppose, sorry, I'm just going to add something onto Nour's question. Again, as you can tell, I'm very much trying to get sort of top tips from you guys. What can we do better to support you at the moment, but also aware that any stress or mental health that you've been through isn't going to magically disappear when the pandemic, if it ever does magically disappear, that some of the trauma that you've been through will stay with you. So what can we do better to support you?
Sonia's taking notes, so of all of your answers, so get ready.
I think if I can just quickly add, I really loved the idea, actually, like Akelekeh mentioned, that as medical students, I feel we're more hesitant to approach proper medical healthcare, and we're just trying to treat ourselves through ourselves. And I really loved Gökdeniz's idea of the facility available in her country about having those facilities for mental health and for others, for homeless people. I think something similar can be adapted into medical education. I personally feel like mental health is something that we students only talk among ourselves, but it's never really addressed on a more professional or a more at a university level, where we're offered any sort of help from universities or any sort of methods that we can work on our mental health, and how we can ensure our mental health.
To add to that, on a personal level, how do I deal with stress? I'm lucky to have a hobby in drawing. So I think having a hobby can help you deal with stress in various ways. So I do draw when I feel stressed. There's also sleep, of course. I think all of us find refuge in sleep. So there's drawing, there's sleep, and then sometimes you could find refuge in some quiet music. Those help me deal with stress. And then now, as regards to what you can do to help us overcome the stress or the trauma that COVID has instigated, I think, as Museera said, there's really nothing that has been done on an official level, because here in my medical school, I don't think there's any formal training on how to do with on mental health, how to deal with stress, depression, and all whatnot. It's just recently that it started, that I noticed. And I think that is a major step in helping medical students, first of all, deal with stress of medical school. And then now we'll see, I think it's going to go a long way too, to deal with the stress and trauma that this COVID, which took us by surprise, instigated. So
also, I think having a close relationship with a good mentor would help a lot with medical students, because we're in this path, but we don't actually know what we're doing or what we're doing is right or wrong, etc., because we don't really know what's ahead of us every day. But if we, for example, had a good mentor that we could, for example, discuss our issues with, or if we can ask, if we have any questions, we can ask them about them, I think that would also help a lot with our mental health too. To have someone like a mentor that we can go to without feeling ashamed, or without having to worry about if we're going to bother them or not. I think that would also help a lot, not only with our career, but with our mental health in general.
I would add, is there time for me to add something?
There is.
Yes, there is. Please go ahead.
I was just going to say, I think we should always think preventative health, and I think prevention is better than cure. So, I'm a bit of a stress head, and I think the best way is to try avoid getting yourself in that situation in the first place. And I know that during this time, there's less than we can control than usually. But one thing I think that medical schools can do is that I think some people have compared trying to learn medical content like drinking out of a fire hydrant, and I think that's somewhat of a potentially accurate representation. And I think there's a big shift in learning from your undergraduate studies, because I'm a postgraduate medical student, going from your undergraduate studies or from your preclinical years and your clinical years. And I think if there was some advice about how to manage your workload, what's your approach to learning, how do you sort all your information, your textbooks or your online stuff, do you want to attend lectures? I think having this as a formalized part of your, I don't know if it is or not, but having that as a formalized part of starting your year and how to approach the year, I think can get you organized and just prevent all that kind of building up towards the end and leading to a bit of a mental health crisis. And I think, and the second thing I have to say is, because of how little we can control these days, I think, like I said before, it's important that we can let go sometimes. I mean, my university is quite good with taking long leaves of absence, coming back for a subsequent year or a subsequent semester. I think that's okay. I don't think there's any race to say we need to graduate by class of 2022, 2023, or whatever it is. The medical career, people will take all sorts of turns. It's not necessarily linear. And I think, we can let go a little bit about whatever vision we might have about what we need to do or what our parents or our families or society expects us to do.
I really like that. And there's something there, isn't there, which you've mentioned before, which is about self-compassion and almost normalizing mental health issues. And we're human, and we've been through a really difficult year, and it's likely to go on for a bit. And so reacting to that is normal. And I think it's possibly us thinking of a way of supporting you, but also allowing you to just acknowledge when things aren't right in yourselves and where to seek help from. We've probably got time for maybe a mini question. I don't know, Nour, is there anything that you think?
A mini question. So all of these questions are so in depth, but I think there's definitely a time for one more. I think the final question that we can end on is, how do you see kind of the future, and what are your thoughts currently about what's your outlook? I think we can end on that.
So much for a mini question.
What's your outlook? I think I can answer about this, and then no, please go ahead.
No, you go ahead.
I think on a personal note, I think this year has given us a lot of challenges. There's also a lot of opportunities. I think it's just been a big turning point of reflection. So I think I look to the future, kind of trying to take the lessons that have been learned from this year and seeing how I could apply those moving forwards. But I'll pass on over to you, Akelekeh, to hear your thoughts.
For me, on a global scale, I think we need to try to stay much more united, because I think when the COVID started, we saw how people were struggling to deal with it individually. But once people came together, once nations came together with the common decision for the lockdown, sensitization on barrier measures and all whatnot, we saw how the load became lighter. So I think moving ahead, if we can focus more on being united on on an international scale, on a global scale. It's going to make whatever comes ahead much lighter to deal with. Not forgetting mental health. So we need to pay a lot of emphasis on mental health.
Thank you, Akelekeh. That brings us to the end of our event. So we want to thank you all for being such an amazing audience. Thank you for your questions and thank you for our wonderful medical students. I want to pass on over to Sonia just to give her final thank you.
Yes, and I think that's such a nice sentence to end on, and actually it segues really nicely into our competition for this year, that I'll leave that hanging for a moment. So thank you for everyone who's been on the call. Do let anyone know who wasn't able to join us, as I mentioned, that it will be recorded. Thank you to Tom and Suki and Imperial College London for supporting us in running this event. We would also just like to share 2 slides with you. One of them is on, as I mentioned, we'll do the WHO. So the WHO is running a global conference on communicating science during health emergencies. It's taking place in June. There is a call for submissions of examples of innovative science communication work. So you can, I think Tom's going to be posting a link, but do look on the WHO website and you can find out more information about that. And then the next slide, as I mentioned, is on this year's global competition. And the winner of last year, one of the winners was Akelekeh, and this is one of his amazing pieces of artwork. And it is on the theme of global unity, which was determined by last year's winners. So we did go out to the students and ask them what the theme should be. We will be hosting this on Twitter and also on our website. So do keep an eye out for details for any medical students in the audience, and of course, spread the word. I feel really sad that we need to end now, but you know, we all need to be at places, and I'm aware of time differences. Reuben in Australia, this is very late for you now. So we are going to end the event. Thank you so much for joining us, but a really, really special thank you to our medical students who have been honest, open and candid with what has been an emotional and just eye-opening journey into what it's been like being a medical student during 2020 and 2021. So thank you, everyone. And with that, I'm going to say goodbye. Thank you.
Thanks, everyone.
Bye-bye, everyone.
Thank you so much for having us.
Bye.
Thank you, everyone.